Is a brain tumor dangerous? Let us understand the difference between a benign and a malignant brain tumor today. Now, brain tumors can be both benign or non-cancerous, or malignant or cancerous tumors. And luckily for us, benign tumors are much more common than cancerous tumors. But is it possible for us to differentiate on the basis of what problems we're having, or the other ways to say whether tumor is cancerous or non-cancerous? So generally speaking, benign tumors by their nature are slow growing. So they become larger. Patients may have a symptom or a problem for a much longer time as compared to a malignant tumor. A slow growing benign tumor may cause symptoms or problems because of the size of the tumor or the location of the tumor. And some common benign tumors are meningiomas, schwannomas, pituitary adenomas. So depending on which part of the brain is getting affected, is it affecting the pituitary gland where you may have hormonal problems? Is it affecting the hearing nerve where you have a hearing loss? Or is it affecting a part of the brain, pressing on the brain where you can have seizures or a weakness of one limb? It may indicate that the tumor is a non-cancerous tumor. On the other hand, gliomas, which is the most common cancerous tumor, can be from grade 1 to grade 4. A grade 1 tumor is almost benign, is very, very slow growing, and may also have a long history, while a grade 4 tumor is highly aggressive, very rapidly expanding, where there's normally a very short history of problems which can only last for maybe a few days to a few weeks, certain cases, and these tumors can grow very rapidly. How do we know a tumor is cancerous or non-cancerous? A lot of times, depending on the signs and depending on the symptoms, you may have an idea. Sometimes, or most of the times, depending on the MRI findings. Now, MRI is the most important test which you have to do for all brain tumors. On MRI findings, depending on the site, the location, looking at different features, we can have a rough idea whether the tumor is benign or tumor is non-cancerous. Certain cases, we may not be certain, we may not be 100% sure, but yes, in majority of patients, on seeing the brain MRI, seeing the patient, other symptoms, we have an idea whether we're looking at a cancerous tumor or a non-cancerous tumor. Now, what's the final proof? The final proof is when we do surgery, the biopsy gives us it's the tumor is cancerous or non-cancerous. Now, in a lot of cases, other places where there's a suspicion of tumor, you must have heard the doctor advises for a biopsy first, and then the main surgery is done depending on the type of tumor. In the brain, this is not the case. In the brain, a tumor inside a skull, in most cases, tumor in the brain, in most cases, whether it is benign or non-cancerous or cancerous, has to be removed completely for the best chance of having a cure. So, in the brain, in majority of cases, we do not advise for a biopsy initially before doing a main surgery, because both of the things can be done together. But however, in certain cases, when the tumors are in an extremely dangerous location or in a very deeply seated area, in a very important area of the brain, where we may think that a surgery is going to be extremely dangerous, may cause extensive harm to the patient, we may just say that let's do a biopsy, confirm what type of tumor it is, and then we try treating it with other modalities. Now, how are these tumors treated? So like I said before, whether they are cancerous or non-cancerous, normally surgery is a mainstay of treatment because we want to remove the tumor as much as possible. It may be causing pressure effects, may be causing mass effects, may be irritating the brain. All this can be done by removing the tumor. Then the further modality of treatment depends on the nature of tumor. In a malignant tumor, in a cancerous tumor, mostly gliomas, it is very likely that you will have to have radiation therapy after that, and some sort of chemotherapy may be also offered to you to control the tumor further. In non-cancerous tumor, again, radiation may be used, but the role of radiation is quite different here. The role of radiation, in certain cases, we may not be able to remove the tumor completely. There may be some bits left which are stuck to a very important part of the brain. To prevent them from growing further, we may ask you to get radiation or even radiosurgery done. What is radiosurgery? It's basically very high doses of radiation in a very, very precise location to kill whatever is remaining. In certain benign tumors, especially schwannomas and certain small meningiomas, we will tell you that let's not go for surgery, let's do radiosurgery straight away, because we can take care of the tumor without doing an open surgery on you. So here, radiation does not mean that it's only confined for cancerous tumors. Radiation or radiosurgery is used quite a bit in non-cancerous tumors to take care of the tumor which has been left behind for some reason, or tumors which may be non-cancerous but in a difficult part of the brain, and which we may feel that surgery may be too dangerous and radiosurgery may be more effective. Chemotherapy, yes, is normally used for only malignant tumors, and that chemotherapy is not very not very extensive in brain tumors. There's a very limited role, but as time is progressing, research is happening, the role of chemotherapy is also increasing. So most of the time, just because of signs, symptoms, we cannot tell you that it's a cancerous or non-cancerous tumor. MRI definitely helps us in giving us an idea whether we're looking at what the type of tumor, and obviously after surgery, after biopsy, we have a certain answer that is it a cancerous or a non-cancerous tumor. So even benign tumors, even though sign benign, can cause symptoms, cause problems because of the pressure, the location, the sign. Surgery is normally the mainstay, the main option of treatment in both cancerous and non-cancerous tumor. Further treatment will depend on the type of biopsy, the type of tumor, and if the tumor has been removed completely or not. Thank you.